Welcome to this short presentation from the Swansea Bay Physiotherapy team. If you've been diagnosed with frozen shoulder by a healthcare professional, we are hoping to provide some information about the condition, some guidance about what you can do about it, and some useful resources for further help. This presentation aims to give an overview of frozen shoulder and will include the basic anatomy to aid with understanding the problem. It also aims to provide some advice on treatments based upon up-to-date research and guidelines. It also will demonstrate some self-help ideas and links to help manage the problem independently. So, what is frozen shoulder? It also has the term adhesive capsulitis, which means the same thing. It can be characterized by a painful shoulder that progressively stiffens. It is thought to occur when connective tissue encompassing the shoulder, which is also known as the shoulder capsule, becomes thickened and inflamed. It is not known exactly what causes frozen shoulder to occur, but it can affect the diabetic population more. It can be classified into primary frozen shoulder and secondary frozen shoulder. Primary meaning there is unknown cause, and secondary can be following a period of immobilization or trauma. Frozen shoulder can be further classified into 3 stages. Stage 1, also known as the freezing phase, normally presents with a greater amount of pain and gradual increase in stiffness of the shoulder. There is much debate over how long frozen shoulder can last for, although it is thought stage 1 can last between 2 to 9 months. Diagnosis can be difficult in the earlier stages of frozen shoulder, as there is not always significant stiffness in the shoulder that has developed. Stage 2, also known as the frozen stage, is where there is a reduction of pain, but stiffness persists with considerable restriction in range of motion. Pain pattern changes from constant to end of range pain, and it is thought this can last from 4 to 12 months approximately. Stage 3 can also be known as the thawing phase, where there is a gradual improvement in range of motion with time. This can take a considerable amount of time to resolve, lasting from 12 to 42 months. These phases make it clear that there is no instant fix to this problem, but it can be made a lot more comfortable with the available treatments. We are just going to take a look at some of the basic anatomy of the shoulder, which may help with understanding the problem. The diagram on the left shows the basic anatomy of the right shoulder. The arrow in this diagram shows the glenohumeral joint. The glenohumeral joint is a ball and socket joint which allows for greater movement and function of the arm. The diagram on the right shows the shoulder capsule. The shoulder capsule is connective tissue that encompasses the glenohumeral joint and can provide some stability. In frozen shoulder, the capsule thickens, inflames, and loses its volume. If the capsule loses volume and becomes tighter, this will restrict shoulder movement. The most common symptom of frozen shoulder is pain and worsening stiffness of the shoulder, often for no apparent reason. The pain can radiate down the arm, and patients can present with difficulty performing functional tasks and pain lying on the affected shoulder. Frozen shoulder is diagnosed by a combination of the history and physical examination. The history includes a gradual onset of worsening stiffness and pain of the shoulder. It occurs more so in the diabetic population and is most common between the ages of 40 to 60. The physical examination would reveal stiffness of both passive and active movements of the shoulder. This means the movements of the shoulder would be equally stiff when the therapist moves your arm compared to when you move it. It can present similar to osteoarthritis due to both presenting with stiffness and pain. An X-ray can be useful to rule out significant osteoarthritic changes if considering more invasive management. So moving on to what may be considered the most important part, how do we treat it and how do we get it better? There are numerous ways to assist with managing pain and increasing range of movement, although it is worth noting there is no quick fix to frozen shoulder. Conservative treatments involve physiotherapy, painkillers and anti-inflammatories, and heat applied to the painful area. Occasionally, more invasive treatments are required if there is difficulty with managing the problem with conservative treatments. These can include corticosteroid injection to the glenohumeral joint, hydrodilatation procedure, and in some circumstances surgery involving manipulation under anaesthetic and a capsular release. Physiotherapy can be helpful to manage your pain and gradually try to increase movement. Physiotherapy would include advice on pain management, exercise prescription, and manual therapy. Prescription of exercises should include range of movement, muscle activation, and postural exercise. Occasionally, manual therapy may be helpful for pain management, which may also help you complete the exercise programs a little easier. If the shoulder has a significant stiffness and pain, and you are having difficulty with physio advice, sometimes a referral for corticosteroid injection or a referral for hydrodilatation could be warranted. If the problem is relatively acute and pain is more of a problem than stiffness, a corticosteroid injection early on can assist with a physio rehab. If the problem has lasted a little longer and stiffness becomes more of a problem than pain, a referral for HD may be more appropriate. These will be discussed a little bit later on in the presentation. So, what exercises are recommended for frozen shoulder? The following exercises are aiming to assist with managing pain and improving your range of movement and function. Unfortunately, there is no quick fix, and it takes time and persistence to achieve these benefits. All of these exercises will be available to print off from the Swansea Bay website below the link to this video. If your shoulder is very painful, shoulder pendulum exercises are useful to promote movement and assist with pain management. While supporting yourself on a table, lean forwards with your arm hanging down loosely. Allow your hand to swing forwards and backwards, side to side, or in small circles clockwise and then anti-clockwise. You can aim to do this for up to 60 seconds, rest, and then repeat 3 times. This can be repeated numerous times throughout the day as pain allows. As you progress, you can do this while holding a small dumbbell or household object and gradually increase the swing. Stretching exercises can assist with managing frozen shoulder. They are often difficult to begin with, but if completed regularly can create improvements in pain and function of the shoulder. To begin with, you may feel a lot of discomfort while holding these stretches, but note that this is normal. For the first exercise on the left, grasp a towel behind your back. Use your unaffected arm to slowly pull your painful arm up your back until you can feel a stretch. Hold this for up to 30 seconds and then repeat 4 to 5 times. For the second exercise on the right, lay on your back with your hands behind your head. Slowly lower your elbows down as if you were trying to touch the floor or bed. When you feel a stretch, hold for 30 seconds and repeat 4 to 5 times. Aim to complete these stretches 2 to 3 times a day if tolerable. If you have frozen shoulder, it is unlikely you will be able to move your arm as much as the pictures demonstrate, but this is expected. Only stretch to the point of tolerable discomfort. If you have a walking stick or broom at home, you can complete the following stretches. For the exercise on the left, hold a stick or broom in both hands. Slowly raise your affected arm out to the side, using your opposite arm to assist. Once you can feel a stretch, hold for 5 seconds and then slowly lower. For the second exercise, stick external rotation, hold onto the stick or broom in both hands, bend your elbows to 90 degrees and slowly rotate your affected arm to the side. Make sure you keep the elbow locked into your side as you rotate outwards. Assist the movement with your unaffected arm. When you feel a stretch, hold for 5 seconds and relax. For the exercise on the right, hold the stick in 2 hands while lying on your back. Using the unaffected arm to assist you, lift the arm straight in front of you and above your head as far as able. Once you feel a stretch, hold for 5 seconds and return to the starting position. Aim to complete these exercises up to 10 repetitions and 2 to 3 times a day, or as pain allows you to. Further exercises that can be helpful include shoulder retractions and wall slides. To complete a shoulder retraction, squeeze your shoulder blades together as far as you feel you can and hold for 5 seconds, relax and return to the starting position. This exercise can increase your awareness of your posture and can be completed in sitting or standing. For the wall slides, place your hand on the wall and climb your hand up the wall as far as you feel able to. Once you feel a stretch, hold for 5 seconds, relax and then slowly lower to the starting position. If you're unable to do this, use your opposite arm to assist this movement. This exercise can be helpful for you to monitor changes in your movement, as you can mark how far up the wall you can reach. Complete up to 10 repetitions of these exercises and repeat this up to 3 times a day or as pain allows.
With any exercise, it is important to start gentle and build up gradually. If the exercises cause only a little pain that eases after you stop exercising, please carry on. This is expected. However, if the exercises cause significant pain and do not settle for more than an hour after exercise, please stop and consult with your healthcare professional.
As well as physiotherapy, a corticosteroid injection to the glenohumeral joint of the shoulder can be an effective treatment. It can be particularly helpful in the first stage if there is a significant amount of pain stopping the ability to complete your physio rehab. The injection may assist with managing the pain, which will allow you to perform your physio and exercises a lot easier. There's a great deal of evidence to support corticosteroid injection and physio for frozen shoulder. The injection can be performed by some advanced physio practitioners within the health board and can also be done through your GP practice. Thoughts to consider are the injection may not always help improve pain and there's a small risk of infection following a joint injection. Further treatments available in Swansea Bay Health Board include a hydrodilatation procedure. A referral for a hydrodilatation would need to come from a consultant or specialist physiotherapist. Hydrodilatation is a high-volume injection consisting of sterile water, steroids and anaesthetic, which is injected into the glenohumeral joint of the shoulder. This is different from a normal corticosteroid injection, as firstly it is performed under X-ray guidance by a consultant radiologist, and secondly there is a larger volume of fluid that is injected. The theory is that the high volume from the injection distends the capsule of the shoulder, therefore increasing available movement. Physiotherapy immediately following the procedure is indicated, and Swansea Bay has had very good results from this treatment, where over 80% have shown a significant improvement in pain and movement. The effectiveness of HD is continuously monitored within the health board. Surgical management can be considered if there is no effect from exhausting conservative measures available. Surgery can involve a capsular release and manipulation of the shoulder joint under anaesthetic. This can be very painful and is equally important to have physiotherapy rehabilitation following these procedures. Since having hydrodilatation procedures available, the numbers requiring surgery for frozen shoulder have reduced within Swansea Bay.
We have discussed the importance of shoulder-specific exercise for subacromial pain. We also know that general exercise plays an important role in pain management. This could be as simple as a regular brisk walk. Follow the link under physical activity guidelines to take you to the government's advice for physical activity. On a weekly basis, we should be participating in 150 minutes of moderate intensity exercise or 75 minutes of intense exercise. Exercise should also include strength and balance. For information on the types of exercise you can try or how to get into exercise, follow the NHS link at the bottom of the page.
As well as all the treatments discussed, we also know that general exercise plays an important role in pain management. This could be as simple as a regular brisk walk. Follow the link under the physical activity guidelines to take you to the government's advice for physical activity. On a weekly basis, we should be participating in 150 minutes of moderate intensity exercise or 75 minutes of intense exercise. Exercise should also include strength and balance. For information on the types of exercises you can try or how to get into exercise, follow the NHS link at the bottom of the page. As well as getting into exercise, we also know that smoking has a detrimental effect on health and healing times. If you would like any information on quitting smoking, please call the number provided or follow the link to the Help Me Quit website. These links will be available on the Swansea Bay Health Board website below where you found the link for this video. To summarise this video presentation, frozen shoulder is a common musculoskeletal complaint. It causes pain and stiffness in the shoulder, and there is no quick fix to the problem. Physio and exercise is important to attempt to manage and improve your symptoms. Further treatments are available if your problem persists or struggles to be managed with physio alone. You can discuss this further with your healthcare professional. If you would like any further information on frozen shoulder, follow the link to the NHS website on frozen shoulder.